Welcome to the webinar, Clean and Safe Dental Unit Water is Possible. Crosstex has the answer. Sponsored by Crosstex, a Cantel medical company. My name is Isaac Molina, and I am the Western Regional Manager for Crosstex. Over the next 10 minutes, I will be discussing recent events in the news regarding major health issues related to contaminated dental unit water lines, one on the East Coast and more recently one in Southern California, both which required hospitalization for numerous children due to severe infections following a dental treatment. These events highlight the critical need for evaluation of every dental operatory water delivery system to ensure safe and clean treatment water at the recommended CDC and EPA levels of 500 colony-forming units of bacteria per milliliter or less, 500 CFU per ml or less. Today I will discuss your options as a frontline practice management consultant and a dental practice partner to ensure your clients understand the variety of products and options in the market. Earlier this year, news broke that 20 children who had recently received pulpotomies at a Georgia pediatric dental clinic required hospitalization due to chronic infections. Further investigation revealed a direct link between these infections and contaminated dental unit water. Posted on this slide is a letter from the Georgia Department of Public Health stating the source of infection has been determined to be contaminated water in dental units. Crosstex was invited to consult with the dental practice regarding best dental unit water line practices, and we are proud to report the initial corrective action of choice for this dental practice was Crosstex Liquid Ultra Solution as a shock to specifically address the biofilm with CFUs as high as 90,000 per ml. Once the existing biofilm problem was eliminated, the Dentapure cartridge was chosen for their ongoing dental unit waterline protocol. Over the past week, we've all seen the reports of at least 10 children in Southern California being hospitalized after complications from receiving pulpotomies, similar to the issues identified in the Georgia Dental Clinic. Following an investigation by the California State Department of Health, confirmation of the cause has been related to contaminated dental unit water with Mycobacterium, the same causative agent found in the contaminated dental unit water line in Georgia. Dr. Eric Handler, the county's health officer, said in a statement, "I'm requiring a complete replacement of the on-site water system so that we will remove the potential threat of infection." The agency said the clinic must submit a written plan for replacement of the existing on-site water system for review and approval. Mycobacterium, the bacteria identified in both clinics, is a naturally occurring microorganism often found in tap water and is resistant to common disinfectants. Water can be contaminated by large amounts of biofilm, which can cause skin, bone, and soft tissue infections. In children, the most common of these syndromes is a cervical lymphadenitis. The narrow bore of the tubing in dental units creates the perfect storm for bacterial growth. It's warm, dark, and moist. Water flows in the tubing at a normal rate and isn't pressurized until it mixes with air water in the handpiece. The water which is closest to the tubing moves slower than the water in the center of the stream. Between patients, overnight, and on the weekends, the water stagnates inside the units, which leads to bacterial accumulation. These tight layers of bacteria, also known as biofilm, need to be removed by using a shock-type product Liquid Ultra Solution is an example. And then followed by a dental unit waterline maintenance protocol for ongoing safe water delivery. The DentaPure cartridge would be an ideal choice. Biofilm is a bacterial-filled layer that tightly adheres around the sides of narrow dental unit tubing. As water flows through the lines, bits of the biofilm can break off and be delivered through dental handpieces, air-water syringes, and ultrasonic units. Research has shown some biofilm to be 50 layers thick. Ask your dental practices, what are you doing to ensure safe and clean dental treatment water for your patients and staff? Yes, staff can be exposed to contaminated water via the aerosols from the handpieces and ultrasonics. It's important to help your clients understand the need to use water that meets the EPA regulatory standards for drinking water at 500 CFU per milliliter or less of bacteria for routine dental treatment output water. They need to understand the importance to consult with their dental unit the dental unit manufacturer about the appropriate methods and equipment to maintain the recommended quality of dental water. They need to understand to follow recommendations for monitoring water quality provided by the manufacturer of the unit or waterline treatment product. And they need to understand the importance to discharge water and air for a minimum of 20 to 30 seconds after each patient from any device connected to the dental water system that enters the patient's mouth. For example, handpieces, ultrasonic scalers, air polishers, air water syringes. DentaPure cartridge water treatment technology is capable of purifying water that meets or exceeds ADA recommendations of water quality, having a maximum of 200 CFU per milliliter. DentaPure cartridge sales have doubled during the past year, thanks in part to many of you. Remember, the DentaPure cartridge is the same product technology developed by NASA for all space flights and adopted by many of the premier dental universities, along with thousands of dental practices. As you can see, DentaPure cartridge has been recognized by numerous independent evaluators as the winner or best product. Among a variety of dental unit waterline treatments, your offices have two Crosstex waterline treatment protocol options: Liquid Ultra Solution and DentaPure cartridge, which can be used independently or used in a combination procedure. Liquid Ultra Solution, often used as a shock, can also be used with any product on the market, tablets for example, that require periodic shocking to supplement recommended product use. We are proud that Liquid Ultra Solution is the only EPA-approved product that kills the bacteria which causes biofilm. Once gaining control of the dental unit waterline biofilm, the dental office can then follow the Liquid Ultra Solution shock with a one-time installation of the DentaPure cartridge. Each cartridge is scheduled to last for 1 year of use. I'd like to show you a brief video of how easy the DentaPure cartridge can be installed into a reservoir bottle.
for a year. Cool.
DentaPure. It's the simple, proven solution to a problem you may not even know you have. The fact is, dental unit water lines are virtual breeding grounds for bacteria. Left unmanaged, these organisms proliferate, and fast. Research shows that in just 5 days, microbial counts can reach 200,000 colony-forming units per milliliter. These bacteria damage your expensive equipment and are hazardous to your staff and potentially dangerous for patients. No wonder the CDC, OSAP, EPA, and ADA have set standards for water dental unit water quality, allowing a maximum of 500 colony-forming units per milliliter. DentaPure meets or exceeds all these agency guidelines. It's essentially rocket science for water, using the same resin bead technology developed for NASA to ensure the safety of water consumed in space. The DentaPure cartridge contains iodinated resin beads. As water passes through, the resin releases 2 to 4 parts per million of atomic iodine isotopes, controlling bacteria and keeping your dental unit water safe for an entire year. Best of all, DentaPure is simple to install. There are no complicated, confusing, or time-consuming protocols. First, remove the dental unit's water bottle to reveal the bottle pickup tube. Align the bottle alongside the pickup tube in order to ensure your DentaPure cartridge can attach to the pickup tube with enough space to fit inside the bottle. Once measured, cut the pickup tube and securely insert the included fitting. Take off the white protective end caps and attach the cartridge with a simple twist. Fill the bottle with water and return to manifold. That's it. There's nothing else to do until next year when you receive your reminder to replace your DentaPure cartridge. Convenient, complete, consistent, and compliant. For clean water, DentaPure is the clear choice. Order now. Go to DentaPure.com today or call your preferred dealer.
Your dental clients trust you to make the best recommendation for treating dental unit waterline. Crosstex has made the decision easy and effective. One company, 2 options. Crosstex Liquid Ultra Solution and Crosstex DentaPure cartridges. Thank you for taking the time to learn more about the Crosstex solutions for safe and clean dental unit water lines, Liquid Ultra Solution, and DentaPure cartridges. Please contact your local Crosstex representative or technical support team at 1-888-276-7783 for additional information. Crosstex has additional online resources available at www.crosstex.com/pure H2O.